Hello, and welcome to another edition of From the Source, COVID-19 Pandemic Edition. I'm your host, Elizabeth Johnson, bringing you the latest information related to the pandemic which impacts your community. On Wednesday, June 10th, the Long Island region has entered Phase 2 of the reopening. Restaurants can reopen for outdoor dining with restrictions. Servers and staff must wear masks at all times. Patrons must wear masks when not seated at their table. All other social distancing rules apply, including maintaining 6 feet between tables. In the town of North Hempstead, businesses may apply for outdoor seating without a fee. The town will expedite the permit approval process for outdoor seating to help restaurants add more seating as quickly as possible. Applicants who complete the process will need to ensure that outdoor tables and chairs are appropriately distanced in accordance with the New York State guidelines. Permit information can be found on the town's website, www.northhempsteadnewyork.gov, or by calling 516-869-6311. All office-based jobs can resume with restrictions. Office buildings will be limited to 50% of occupancy capacity. Employees will need to undergo daily screenings with tools like temperature checks and questionnaires. Masks, plexiglass, or other barriers will be required if 6 feet distance cannot be maintained. Signage and distance markers will be required in closed quarters like bathrooms and break rooms. No congregation will be able to take place in small areas, and in-person meetings will be limited. No meetings can take place without social distancing. No communal sharing of food or beverages. In-store retail shopping can resume with restrictions. Retail stores will be limited to 50% maximum occupancy. Employees must wear face coverings when interacting with customers and coworkers. Customers must wear face coverings, if medically able. Stores must control foot traffic with designated signage and markers. Stores should continue use of curbside in-store pickup where possible. Shared amenities should be closed, including self-serve sampling stations and bars. Store owners can prohibit customers who don't wear masks. Malls are closed, except stores that have external entrances. All mall retail may proceed with curbside pickup. Barbershops and hair salons have reopened with limited services and restrictions. Salons and barbershops will be limited to 50% of maximum capacity. Only hair services will be available. Massages, hair removal, beard trimmings, facials, and nail services will remain prohibited. Employees must wear face coverings and face shields while performing hair services at all times. Customers must wear face coverings at all times. Services will be available by appointment only. Employees are strongly encouraged to get tested before reopening, and customers are urged to inquire about employee testing status. Employees interacting with customers must be tested at least once every 2 weeks. Shops will be required to keep a log of customers to perform tracing in the event staff test positive. Real estate services like buildings and property management, leasing, rental, and sales may resume with restrictions. And motor vehicle leasing, rental, and sales may also resume with restrictions. For more details and to read the complete safety guidance documents for all industries reopening in Phase 2, visit forwardnewyork.gov/Phase 2 Industries. I had the opportunity to speak with Jason Villano of ProMet Physical Therapy to speak about how his business is handling the pandemic. I have the opportunity this morning to speak to Dr. Ryan Martin and Jason Villano of ProMet Physical Therapy, Inc. Now, Dr. Martin, good morning. It's good to see you.
Thank you, Elizabeth. Thanks for having us on today. We really appreciate the opportunity. I'm doing great.
I'm glad to hear that. I know that your business has several locations, and that you've recently opened up, I guess within the last year, a location that is in our viewership area, located on Community Drive.
Yes.
Can you talk to us a little bit about your business and what you provide? I know you are an essential service.
Yes. Well, again, Elizabeth, thank you for having us on. We really appreciate the opportunity to speak about some of the things that we've been doing during these obviously difficult and trying times. But we make the best out of any situation, and that's kind of what we've been doing from the start. So we're here for our patients. We're essential to our patients that need us. Our team was very receptive to the plan that we had. Everybody basically did their part to kind of keep everything afloat so that we can be there for our communities and be there for our patients that need us. But one of the ways that we adapted was just by keeping our mission strong. And our mission is to inspire others to achieve their full potential. And, because of guys like Jason Villano, Doctor of Physical Therapy, and some of our other team members, we all came together and said, what are the best ways that we're going to be able to accommodate our patients? So many people had surgeries in the middle of this. And so, while it's a fine line to tiptoe, we've obviously made some changes in terms of, office-wise, wearing masks, gloves, screening procedures, doing all the things and crossing all the T's and dotting all the I's we can to help people feel safe. And so now we're starting to see some people come out of their house and come out, and more people require our care. And so all it is making sure that people understand that we're taking and doing the things that we need to ensure the ultimate physical therapy experience.
So Jason, when a patient comes into your facility, what is the first thing that happens?
So we take a few precautions just to make sure that the patients are safe, our faculty is safe, and everybody else in the office is safe and comfortable. So first thing is that we've done is we've expanded our office hours just to make a little bit more room for our patients to come in, so there's not more than 1 to 2 people here at the same time, so we can maintain our social distancing rules and make sure that everybody have enough space. Our office itself has been cleaned and disinfected multiple times a day, just to make sure that we keep up with the CDC guidelines. As a patient will come in, they usually have a mask and gloves on. We recommend that patients do have that protective equipment on. We also take some pre-screening measures before a patient does come in. So we have contactless temperature readings with our thermometer that we use. And we also make sure that the patient doesn't have any history of present symptoms, or if they were, no more than 14 days prior to coming into the office. And we also offer the patient the opportunity to do a telehealth visit. So the patient doesn't physically have to come into the office. We can treat them virtually through a system that we use to treat them from the safety of their home.
Jason brings up a really good point. One of the ways that we've been able to accommodate people who don't feel safe coming out of their home and into our clinics is by our telehealth system called Go Live with ProMet. And so we put that together. Our operations committee, we kind of put it together the best way we could to put a product out there that people can utilize and that we can carry our services over into the telehealth department. It's not optimal in terms of physical therapy because obviously we're a touchy-feely profession that require the use of our hands. That's our greatest tool. Our minds and our hands are the two tools that we use to get to know our patients, to understand how they perceive the world, how they perceive their injury, And so telehealth has been a really good way for us to keep communication with patients that don't feel safe coming into the clinic and may have an issue with leaving their home. And it's actually been pretty successful in terms of our delivery.
Jason, when someone calls and says, oh, I mean, I'm assuming that that's exactly what happened right at the beginning of March or at the end of March when we went into pause, that people just said, I can't expose myself.
Yeah.
There's been a big change, especially when this first started. So a lot of patients themselves wanted to make sure that they were cautious and safe enough for their protective environment, but also for their families. And we completely respect that because the patient always comes first for everything that we do. So with the virtual visits, we were able to see patients virtually over the phone or through their computer. We were able to build a great connection with the patient as we normally do when they would come in. But the biggest thing that was lacking was our physical touch and the physical feel of being here for the PT session. But I feel like it really didn't take away from anything that we were trying to bring to the patient. We were still able to find out what was going on with the patient, their problems, and together come up with solutions to help reach their goals. So virtual visits could be anywhere from a few minutes up to half an hour, 45 minutes, where we were able to go through everything that we needed to discover and really help the patient reach their goals and a better quality of life while they were inside with their families. Because, you know, with everything being closed, there was a lot of decrease of their activity. They were more stationary at home. We were playing regular therapists instead of physical therapists sometimes.
You know, that's Jason, you touch on a really important aspect of our care. And you think of physical therapy, like, you know, that speaks for itself, right? We help people move better. We're movement experts, movement specialists. One of the things that separates us, I think, is the reason why we do what we do. And one of the things that the words you'll hear a lot when we talk from therapists and therapists front desk to our patients is empathy and emotional intelligence. And we understand that when people are injured, when they're in pain, they experience pain differently. And so really get to understand, and if you think about it, it's what medicine was supposed to be. It's supposed to be get to know your patients in your neighborhood. And so for us, we've used this platform to kind of push us into this primary care clinician type of role. And we've been playing this role for the last 10 years. In our communities, in our neighborhoods, families, teams, all kinds of athletic programs that we've been able to grow on. They trust us with their care because they know that we care. So to speak on what Jason said, it's a lot of psychological. It has to be. And because you can't treat the person if you can't understand the mind. That's a really big factor. I'm glad Jason brought that up.
I know that you have a very great staff, especially at the Manhasset location. So could you give us the address of your Manhasset location?
Sure. I mean, you can't miss us. We're right in the back of 444 Community Drive, Suite 103, 105. We have a beautiful facility that we designed to kind of be an open space. It's kind of warehouse chic. There's all the tools that we need in there. We have some turf. And basically, when it comes down to, whatever injury, whatever pain, whatever the person may need, everything in our location and the people there to deliver the kind of care that we've become known for in our other locations. And we're really grateful to be able to provide these services to the community of Manhasset and the surrounding neighborhoods. We're really happy to be here, and we thank you for trusting in us and also for getting us on this call and having us on your show.
Wonderful. Thank you so much for joining me today.
Thank you so much for having us, Elizabeth.
Protests continue. Last week in the town of North Hempstead, many areas had peaceful protests in their local villages and the town in response to the massive protests throughout New York State. Governor Andrew Cuomo is pushing New York to pass a Say Their Name package of police reforms next week in response to the ongoing protests against police brutality across the state and country. The reform agenda announced by Cuomo during his daily briefing includes legislation elected officials and activists have long sought to hold police more accountable including making their disciplinary records more public, having an independent review of police killings, and criminalizing police chokeholds like those used in Eric Gardner and George Floyd's death. It will also make false 911 calls based on race a hate crime. Cuomo said the legislative package is named for a long list of deaths that were the result of police abuse, of which Floyd was the breaking point. Primary elections. There will be a primary election held on June 23rd. Applications for absentee ballots are due soon. If you plan on voting by absentee ballot in the June 23rd primary election because you're concerned about COVID-19, please be sure to return the application to the Board of Elections as soon as possible, as no application will be accepted if it's postmarked later than June 16th. If you have any questions, contact the Board of Elections at 516-571-2411 or visit their website at www.nassauvotes.com for more information. The Nassau County Legislature has approved $30,000 in funding to enable the Board of Elections to proceed with the June 23rd primary. The funds, which will be reimbursed by the state, will pay for sanitizers for equipment, personal protection equipment for poll workers, and mail supplies for absentee balloting. Religious services. The Diocese of Rockville Centre announced that Masses will resume at Catholic churches across Long Island, with strict safety precautions being taken to protect worshipers, including limiting services to 25% capacity, 1 pew open and 2 pews cordoned off, and mandatory mask wearing. Though Masses will resume, there will be no communion distributed and no sign of the peace. The dispensation from the obligation to attend Mass is still in effect, and those who are most susceptible to the coronavirus are encouraged to still remain home. Veterans. The U.S. Veterans Affairs Department announced that it will resume committal services at all but 2 national VA cemeteries. The VA will contact families who were unable to hold committal service due to the pandemic and arrange memorial for their loved ones beginning in July. On Long Island, internments scheduled on or after June 22nd will be offered the option of a committal service at the time of internment. Island Harvest has just launched a free food package distribution program specifically to help seniors in need. Food packages include items like cereal, rice, pasta, beans, canned vegetables and fruits, canned proteins, cheese, shelf-stable milk, juice, peanut butter, and soup. To qualify, you must be 60 or over, a New York State resident, U.S. and non-U.S. citizens are eligible, and verify your income. To see if you qualify, contact Marilyn at islandharvest.org or call 631-873-4775. In order to help seniors during this difficult time, the town of North Hempstead has waived all Project Independence taxi ride fees for regular food shopping, medical appointments, and COVID testing during the pandemic. And they've expanded the shopping program to 7 days per week, town-wide. Town of North Hempstead residents can call 311 to make an appointment. The Holocaust Memorial and Tolerance Center of Nassau County is hosting virtual programs you can participate in at home. Check out their upcoming programs at hmtcli.org/events. Opioid overdoses have skyrocketed since the pandemic began, so knowing how to stop an overdose and save a life is more important than ever. While in-person opioid overdose prevention trainings may be on pause for a while, you can now do it remotely. Check out the New York State Community Calendar of opioid overdose prevention trainings to learn. Visit www.newyorkoverdose.org. Due to the very real possibility that anyone attending a large-scale protest could be exposed to the coronavirus if not very careful about social distancing, the state is urging anyone who attended any recent protest to get a test as soon as possible. In order to encourage testing, the state has expanded criteria so that anyone who has attended a protest qualifies for getting tested. There are now over 800 locations statewide where New Yorkers can get a diagnostic test. If you're concerned you might need a test, but you're not sure if you meet the criteria, take the online self-assessment test at www.covid19screening.health.newyork.gov. In Nassau County, all workers interacting with the public are now eligible to receive diagnostic testing, whether you have symptoms or not. To locate a testing site near you, visit coronavirus.health.newyork.gov. Find a test site near you. To support our first responders, New York created the First Responder Fund. The fund will assist COVID-19 healthcare workers and first responders with expenses and costs, including childcare. The State Department of Health is accepting donations for the fund. Donations can be made electronically at www.healthresearch.org/donation-form. That's all for now. Stay tuned to North Shore Television as we continue to provide you with the latest news related to the pandemic in your neighborhood. In the meantime, wear a mask in public, social distance at least 6 feet, and properly dispose of your PPE in a trash can. And stay safe.